The Canadian government has introduced temporary border measures aimed at preventing the international spread of the Ebola virus. Under the new directive, foreign nationals who have visited the Democratic Republic of the Congo within the previous 21 days are barred from entering Canada, while Canadian citizens and permanent residents remain exempt from the entry prohibitions. Those arriving from affected regions in Central and East Africa are required to complete a mandatory 21-day quarantine upon arrival. The public health policy comes as health agencies in the DRC work to contain an active Ebola outbreak that has recorded over 2,100 cases and more than 800 deaths. Canadian public health officials state that restricting entry is a precautionary measure to minimize domestic health risks and manage traveler processing capacity. However, the policy runs counter to guidance from the World Health Organization. The WHO advises against broad travel and trade restrictions, warning that unilateral border closure can create stigma, hamper international assistance, and disrupt critical logistics needed to control epidemics at their source. Canada's policy adjustment reflects broader border strategies recently adopted across North America, where neighboring authorities have also tightened travel protocols for individuals arriving from affected zones. Public health bodies in Europe have maintained a different approach, recommending against blanket entry bans to ensure the uninterrupted delivery of medical supplies and field support. Canadian authorities emphasized that enforcement mechanisms remain active, with strict financial penalties for non-compliance with health monitoring and isolation orders. As international health organizations and national governments balance public safety with global mobility, the situation highlights the diplomatic challenges of managing health emergencies. The long-term containment of the outbreak will require balancing regional public health measures with sustained support for frontline health workers in Central Africa. I am Otaria Benjamin, reporting with clarity on the issues that impact our continent. This is Media Room Africa.